procedures are really, you know, extra things that we can do radiology wise, where we add different types of contrast that shows up differently than the surrounding tissues on radiographs. And the thing about special procedures, they used to be super common and there was a whole bunch of them, you know, and a lot of times they were kind of invented, if you will, or developed with a specific goal in mind of trying to diagnose a specific problem that was associated with an organ. The thing about special procedures, though, is that once ultrasound came out and people got good at ultrasound, and then once CT and MRI came out and people got good at that modality, then a lot of these special procedures went by the wayside because they weren't needed anymore. There's a lot of the stuff that we can do with special procedures. Those other modalities, specifically ultrasound, can really help out and give us much more information than a special procedure used to. And so a lot of the special procedures we did are really scaled down, and probably we only do maybe 10% of what we used to do before ultrasound came around. So the good news about that, again, is we're not going to talk about special procedures that you're never going to use. We'll only talk about some of them that you might use every now and then, and you need to be a little bit familiar with them. So that's kind of how we're going to handle this special procedures thing. Okay, so commonly performed special procedures, still that we need to at least touch on a little bit. There's one called an esophagram, and that's a study that you give a dog barium solution, which is, barium is a, we're going to talk more specifically about it in a minute. It shows up bright white or radiopaque on x-rays, and it's a liquid. And so we would give it some of this solution. It's a kind of a thick liquid. You would give it in the dog's mouth, and they swallow it down, and you can watch it go through the esophagus and dump into the stomach. Okay, so an esophagram is a special procedure using barium solution to evaluate the esophagus and esophageal motility. Okay, we still do it, still do esophagrammes because ultrasound really can't evaluate the esophagus, and so it's still useful for that purpose. Upper GI study is where you give a dog barium solution again into the stomach. Usually you'd give it by a stomach tube, which we will talk about. And then you take multiple x-rays over time, usually in a dog, maybe up to 6 to 8 hours over time, and watch the barium go through the stomach, through the small bowel, and end up in the colon. And you're typically looking for an obstruction. We don't do many upper GI series anymore because ultrasound has kind of taken the place of that. Positive and negative and double contrast cystogram. This is a study of the urinary bladder, where we would place a catheter through the urethra into the bladder, and we would either infiltrate the bladder with positive contrast, and for this you would use an iodinated contrast material, which also shows up white or radiopaque on radiographs, or we can use negative contrast, which is room air typically. A pneumocolon study, we already talked about that, and people can do pneumocolon studies to differentiate, place a catheter into the dog's rectum, blow up the colon with gas, and that will help us radiographically differentiate what is colon versus what is small bowel. That's the typical use for a pneumocolon study. And again, ultrasound has replaced most of these. Okay, the first one we're going to go through a little bit is an upper GI study, or upper GI series. Typically, people would do these to evaluate. They would take plain films and they would look at the bowel, and it's a vomiting dog on the plain films, and you decide, I can't really decide for sure, does this dog need to go to surgery or not go to surgery? There's some iffy things, there's some questionable things. I'm on the fence, I can't decide. And back in the old days, before ultrasound came out, your next step then would be, let's do an upper GI series using barium solution that will help us decide, is this dog or this cat obstructed or not? Okay. Again, we don't do them much anymore because we ultrasound instead. Ultrasound's quicker, faster, and much less mess. What do you use for a contrast material? You use different types of contrast that you can use. Barium solution, it comes in a gallon jug that you will show you a picture of here in a second. But barium is what you typically will use for any upper GI study. Okay, so if you're going to give barium, that's what you're going to use for an esophagram, for upper GI study, for lower GI studies, for barium enemas, all that kind of stuff. You're going to use barium solution. Okay, barium is only given into the gastrointestinal tract. Okay, Iodinated contrast material, you wouldn't routinely use that. That comes in a little vial. When you look at it, it looks like clear water, okay? But radiographically, it's radiopaque. It shows up bright white, okay? Iodinated contrast material, you don't use routinely for any type of a GI study. You would want to use barium solution. Also, you will also see these things that people sell at shows and, you know, veterinary conventions and stuff like that. The sales guys will sell these things called, it's an acronym called BIPs, which stands for barium impregnated spheres. And basically what these are, it's a big capsule, and inside that capsule is the varying sizes of plastic round things that each one contain barium, okay? And the idea here is that once you give a couple of these capsules, they go into the stomach. Well, the capsule part around it dissolves away like any capsule, and then it unleashes these barium impregnated spheres that were in the capsule into the stomach. And some of these spheres may be 2 millimeters in diameter, some of them may be a centimeter in diameter, okay? So they're varying in sizes. And the idea with these BIPs things is that if there is a complete obstruction, the little capsules, the little diameter capsules might be able to get through the obstruction, but the big ones won't, or they'll get stuck, okay? Having said that, don't waste your money. The BIPs are totally useless. They've been shown to be totally useless. They don't do anything for you. And so if you see these BIPs things that it shows, don't waste your money to buy them. They don't work, okay? Okay, so in the lower right corner, this is barium solution. Barium is a metallic opacity, you know, the 5 radiographic opacities, and barium is metallic, okay? Typically it's bright white. It comes as a solution like this, as a gallon jug. It's kind of thick. It's a thick solution that kind of, if you're gonna make pancake syrup kind of consistency, okay? The taste of barium, if you ever taste it, it's not bad. It kind of tastes like a chalky milkshake, okay? People have used it, and from what I understand, not that I've ever done this, but it's apparently it really helps if you have a hangover to take a little bit of barium the next day. So I'm sure none of us have been in that situation, but anyway, that is what's reported that could be possibly be helpful with too. Okay, so the most common form of barium is in this bottle here, this solution. And typically when you're going to do an upper GI study with the dog, you would dilute this half and half with tap water. It doesn't need to be sterile water. After all, we're putting it into the dog's stomach and mouth, okay? So you would dilute it, use it 50-50 solution, dilute it half and half with tap water, and that's what you would give when you want to do one of these upper GI studies, okay? This little vial that you can see down in here, it's an injection vial. That's iodinated contrast material, okay? We will use that to do some studies, but that's not what you want to use for an upper GI study, okay? This toothpaste looking thing here is barium toothpaste. It's barium paste. And so it has the consistency of toothpaste. You probably will never use it. Some people will use it for an esophagram, but you're not going to use it for an upper GI. So basically in your practice, you're probably going to want to buy barium like this, and it will last you a while. It's relatively cheap, and you can probably forego these things, okay? There's other forms of barium that you can buy too. You can also buy barium like this that's mixed, that comes as a powder, okay? And then it comes in a little tub, kind of like you would buy cottage cheese or sour cream at the grocery store, and it has this white powder in it, okay? And you can take that powder and you can mix it with water yourself, but it works out not well at all, because no matter how much you mix it up, how forceful you mix it up, even if you put it in a blender, that powder very quickly will settle out to the bottom and to the gravity dependent portion. And so the result of that is you get a poor quality study. If you give it to the dog in their GI tract, it tends to settle out. That's a condition called flocculation, if you really want to know, as the barium settles out as it travels through the gastrointestinal tract. So if you have barium powder, that's probably not the way to go. People get it because why? It's the cheapest form, okay? But again, you get what you pay for. So don't use barium powder if you can avoid it. You want to buy this liquid suspension like this and mix it half and half with water. Problems with barium. Barium, if you aspirate it and get it into your lungs, and if you can kill the dog, okay? Barium is not good if you get it into lungs. And so you got to make sure the dog doesn't aspirate it. If you get a little bit of it in the, a couple cc's in the lungs, that's probably not a big deal. Okay. But if you get much in the lung, then it's never going to come out. There's no way to suck it or vacuum it back out, and it's going to be there forever. And it will interfere with oxygen exchange in that portion of the lung. So that's not a good thing. Okay, so this is an example of that. This is a cat, and the veterinarian passed the stomach tube, but unfortunately, instead of passing it into the esophagus, they passed it into the trachea and then infused the lungs with barium. And this is a dead cat walking right here. There's nothing you're going to be able to do about it. Once it's there, it's not coming out, and it's going to stay there forever. And it's not a good thing. Okay. Again, iodinated contrast material, there's several types. This is the one that comes in the little injection bottle. It looks like water. It shows up white on x-rays. It has a really nasty, bitter taste. It's kind of oily, and it's super concentrated stuff, so very hyperosmolar. We don't want to use iodinated contrast material routinely for upper GI studies. Okay, let's just say that. Okay, how do you do an upper GI study? If you're in your practice and you've got a dog that's vomiting and you're wondering if he's obstructed or not. First thing that you want to do is take plain films. So you take plain abdominal films of the abdomen, and before you would even consider to do one of these studies, you got to make sure that the stomach and the small bowel are empty. There's nothing in there, okay? The reason being is if you have some food in the stomach and then you get barium with it, it's hard to tell if is it food or is it a foreign object, because it's going to all look the same. You're going to have this barium solution mixing with whatever's in the stomach, and you can't decide if it's food or if it's a foreign object. Okay, so make sure that the stomach and the small bowel are free and don't have nearly any ingested at all in them before you even start the upper GI study. The dose for one of these studies is quite a lot, and so if you think about it, it's 6 to 10 mils per pound of body weight. And so if you have a 60-pound dog, okay, you're going to give almost a liter of barium to that dog, which is a lot, okay? And the whole idea here is you want to give enough barium to where you take that stomach from having nothing in it and distend it really big, full of barium. So then you can evaluate it emptying and the stomach wall and the edges and things like that. So you want to give enough barium to distend the stomach fully, which is again about 6 to 10 mils per pound. Okay. You also want to administer the barium via a stomach tube into the stomach, not the trachea, but into the stomach. Okay. You don't give it by mouth. You don't give it by a syringe and let the dog eat it. You don't put it in a food bowl, mix it with kibbles and dog food and let the dog eat it. Okay. Again, if you mix barium with food, how are you going to know once it gets into the stomach if the filling defect you're looking at, is it due to a foreign object or is it due to food? Can't tell. Okay. So once you give the barium into the stomach via a stomach tube, then immediately start shooting films. So as soon as you get the stomach tube out, you place the dog on the x-ray machine and you start shooting images. So typically you're going to shoot a lateral view, a right lateral view, typically in a VD view at 5 minutes. You're going to repeat it at 10 minutes. You're going to repeat it again at 15 minutes. And then you do it every 15 minutes for the first hour and every 30 minutes up to 4 hours. And then you keep going about every hour, every 30 minutes until the great majority of the barium's in the colon. So nobody likes to do these. They're a mess. They take forever in a dog. In a cat, you'll be done in an hour. But in a dog, it can take a long time for this stuff to travel all the way through the gastrointestinal tract. It's a pain in the ass, and that's why everybody does ultrasound instead. Okay. Mistakes that people make when they try to do an upper GI series, probably the number one mistake is they don't give enough barium. Again, we said you want to fully distend the stomach with barium when you do one of these, which is 6 to 10 mils per pound. I've seen it, I don't know how many times, where you'll have a Labrador that's a 80-pound dog that is vomiting and the veterinarian gives them 10 mils. Okay. And it's just this little teeny little pool of barium that sits in their stomach, and there's no impetus for the stomach to contract or move the barium along or anything, and you get nothing out of it. Okay. The other thing is, again, they don't administer the barium properly. They don't give it with the stomach tube. Okay. They put the barium in a bowl and mix it with food and let the dog eat it, or they give a little bit by mouth, and then it turns into a non-diagnostic study. Okay. So again, here's what we would want to use this stuff here, mix it half and half with water, and that's what you want to give with a stomach tube. So here's our set that we have ready to go. We have a bunch of these syringes with that big tip on the top, on the end of it there. And that tip fits into the edge of of this tube, which is our stomach tube. And then what we do is we pass this here, which is the syringe case this came in, that you cut the end of it off and you wrap it with that white bandage tape to take the sharp edges off of it. And then you put that in the dog's mouth, and that way the dog can't bite the tube in half. So that's a speculum that you can use so the dog doesn't crunch the tube in half and then swallow the tube, which is a whole nother problem. Okay. So the first thing you do when you get ready to administer the stomach tube and administer the barium when you're doing one of these is you take the tube that you're going to use and you, on the outside of the dog, okay, you don't pass it into the esophagus, but on the outside of the dog, you measure the length of the tube from the mid-abdomen where the stomach is, and you measure the length of it up to the tip of the nose, and then you put a little marker on the tube. That's what that piece of tape is, okay? So you can use the piece of tape, you can at least use a little Sharpie pen, and you mark the tube. And the reason why you have to do that is once you start to pass the tube in the esophagus, it's really hard to tell how much is already in the dog. Okay. And if you mark it ahead of time, then once you get up to the mark, you know that the rest of the tube is in the dog and probably in the stomach. Okay. That's one of the problems people make is they start passing the tube and they think they've put it in there, 2 feet worth of tube, but it's only gone in 1 foot worth of tube. And now it's in the trachea and you start giving the barium, and that's not a good thing. Okay. So the other thing that I do is once I put the tube in, I pass it into the esophagus, into the stomach, just to make damn sure, because I'm paranoid about giving it into the lungs. The next thing I do is take a lateral radiograph while I hold the tube, and I want to see the end of the tube in the stomach. Okay. It's real easy now that we have DR systems. And again, you get that image in 2 or 3 seconds that shows up on your monitor. So just ensure that, yes, the tip of the tube, I can see it in the stomach. Once you verify it's in the stomach, then you start loading your barium up. And so you would pre-fill, if this, this dog's 60 pounds, you're going to have, these hold like 60 cc's of barium. And so you're going to pre-fill maybe 10 of these syringes with barium. And you have them all ready to go, and you slam it as fast as you can. Okay. And you inject it into the stomach, pull the tube out, and then start shooting your x-rays. Okay. The times that the stomach and the small bowel should empty, the GI transit time, is extremely variable, especially in a dog. Okay. Typically, and kind of as a general rule, the stomach, after you give the barium, should be empty of barium, and it contains no more barium, somewhere between 30 minutes and 2 hours. Okay. The small bowel should be empty somewhere between 1 hour and 6 hours. Again, huge time windows here. If there is a little bit of food present in the stomach or the small bowel, it's going to slow GI transit time down. So it will be even longer. In a cat, again, cats, their GI system works really quickly and you're done in an hour. It moves through really quick. So here's just one example of a set of films after 15 minutes. Here's the stomach. It's chock full of barium, this white stuff. Here's the stomach here. There's the pylorus. This is the fundus up in here. And just the barium is already moving through the duodenum and randomly throughout the small bowel. It's very normal, lazy loops throughout the small bowel, moving through nicely. Okay. What you're going to look for is a region of bowel that is dilated, or there's a filling defect. There's a part of the bowel that doesn't have contrast in it, doesn't fill with barium. Okay. That's typically what you're going to look for. Now realize all of this small bowel, like right in here, you can see a portion of the small bowel that is thin. Okay. But all the bowel has peristaltic motion. So most likely that's just an area of the bowel that is undergoing peristalsis. Okay. So the key when you're looking for defects on contrast studies is if you see this area here that's thin and you think, well, maybe he's got a stricture in there, you want to make sure it's repeatable at the same spot over multiple time frames. Okay. So seeing a potential lesion, the key is let's look at that lesion in the bowel and see if it's repeatable over time in the same spot. Okay, here's an example of an animal that's obstructed. Here's barium in the stomach, going through the small bowel, and then we get down to this portion of the small bowel, and this area of small bowel is significantly more dilated than this small bowel. And you also note that this is the diameter of the bowel, and it's much greater than the width of the height of the vertebral body. So it's too big. We've already learned all that. okay? And then if I go down near that area of obstruction, then I see this thing. So this is some kind of peach pit. You can see it's repeatable over here. Some kind of filling defect that's stuck in that area of the small bowel, and the bowel adjacent to it is dilated, okay? So that's something in there that is radiolucent that without the barium, we wouldn't see it. Of course, if you did an ultrasound, you would probably find it too, okay? So that's the useful things for barium. Here's another one. So here's another dog here. Again, there's another peach pit or something that's stuck in this portion of the bowel, and you kind of see it right in here too. Big dilated bowel loops next to it. This is an animal we gave barium, and he's got an intussusception in the cecum of the colon. That's a really crappy old film. Here's a dog that has a linear foreign body. So this dog ate, I don't remember, panties or something. And so here's the stomach, here's the duodenum. And again, if you remember on our other pictures that we saw, the duodenum should come out here and go right down the right lateral aspect of the abdominal wall. Well, now this is the duodenum. It's plicated, it's bunched, it's climbing upon itself. So it's really big and dilated and abnormal in appearance, plicated in appearance. So that would be typical of a linear foreign body. And that's what we pulled out right there. So, okay, the other thing that I have to caution you about in kitty cats, they have what's called the string of pearls sign. So if I give barium in, and it doesn't happen in all cats, but it happens in probably half of them, that the barium, as it goes down the duodenum, and it only happens in the duodenum, they will form these little pockets of barium, and people have called it the string of pearls because it looks like a string of pearls. It's the string of pearl sign, okay? The weird thing about it is, you know, cats are different than dogs, of course. And if you look at it, you know, 2 minutes later, this part of the duodenum that is now showing the string of pearl sign will look completely normal. And it's not a foreign object. It's not anything in there that's abnormal. This is a cat thing where I think the way I used to remember it is cats are different, right? And so this part of the duodenum right in here, it's probably never in its life ever, quote, seen barium before. And it looks at this stuff coming through it and it goes, holy shit, what is this stuff? And it kind of, you know, contracts down in like a panic moment, okay, of the duodenum. And then it forms these little pockets of barium. And then it finally figures out that, oh, you know, this stuff isn't so bad. And then it relaxes, okay? So cats get this string of pearl sign. Don't let that confuse you. A pathology, if you shot an x-ray immediately after this, it's going to be normal, okay? Okay, a gastrogram is, you'll never do one, so we don't need to spend any time on it. It's a mini upper GI series where you fill the stomach up with barium and you evaluate the stomach, but you don't follow it over time, okay? Again, you will never do one. Okay, there's barium in the stomach. Okay, there it is again. Okay, don't worry about that. Oh, a cocogram, that you can, this is kind of fun to do. This is, you know, one of the ways that if you remember from our lecture talking about stomach, we play with the stomach bubble, okay? So if you have the dog in right lateral view, the bubble in the stomach, the gas in the stomach is going to float up into the fundus, and you're going to have fluid in the pylorus. On the left lateral view, it flips around the other way. Okay, and the whole idea here is we're trying to, if we have something that's stuck in the stomach, typically in the pylorus, if we put gas around it, that's a different opacity, radiographic opacity, than ingesta or a foreign object in the stomach. And if we put gas around it, we might be able to see it. Okay, one way to put gas around an object is to fill the stomach up with gas. And you can do this a couple of ways. So instead of using positive contrast like barium, we would use negative contrast. So you can pass a stomach tube into the stomach and blow in it, okay? You blow in the stomach tube and you fill the stomach up with gas and you take an x-ray, okay? You have to be pretty quick because a lot of times the dog will just burp the stuff up by the time you're taking the x-ray, okay? The other thing that you can do to put gas in the stomach is you can pass a stomach tube, or you can just give by mouth in a syringe half of a Coca-Cola or a Sprite or a beer or whatever, some kind of carbonated beverage that you want to give the animal. And this idea is that we want the animal to swallow a bunch of gas, okay? And the dogs get that carbonated beverage in their mouth and this feels weird and they get, you know, they start even swallowing more gas and stuff like that. And so the idea of a cocogram, the dose is half of a Coke. You give it typically by mouth and then you shoot an X-ray, and that carbonation will blow the stomach up, or at least partially blow it up with gas, and allow you to hopefully diagnose something after you have filled the stomach up with gas. Okay. Again, the dose is half a coat, because then you get to keep the other half and drink the other half while you're taking the X-rays. Okay, so here, this is at the stomach, it's got gas in it. This is a foreign object seen in the stomach right in here, and we've put gas around it, so now we can see it inside that pyloric region of the stomach. So that was a positive cochogram study. Okay, an esophagram is kind of like an upper GI study, except this time we're not going to give the contrast material via stomach tube. This time we are going to give it by mouth, and you give much less, and we evaluate the esophagus. So typically we're going to look for a dog that has an esophageal foreign object, has a stricture of the esophagus, or a lot of times megaesophagus, which is a big dilated esophagus that you'll talk about when you do thoracic films. Okay. Esophagams, typically, if you go into a teaching institution or a university, they're going to do these with fluoroscopy, which is video X-ray. And so you can actually watch the contrast material move down the esophagus in real time on a computer monitor. Normally, when you give the barium contrast, the esophagus is nice and thin and smooth. And the bolus of contrast in a big dog will start off, they'll swallow it, you'll see it go down into the pharyngeal region. It flips the epiglottis. It starts off in the cervical esophagus, and that bolus of contrast you can see move in real time from the cervical region into the stomach, maybe in about 10 seconds. It goes right down and bloop, falls into the stomach. Then another bolus comes right after it, bloop, falls into the stomach. Okay. If dogs have megaesophagus, then they lose that contractility of the esophagus, and it just kind of sits in the esophagus and pools there. And eventually the dog will regurgitate it back up. Okay, that's called megaesophagus. So here is a dog, and this is plain film X-ray, so you can't see it real time, obviously. But here's a little bit of esophageal striping. So this is a little bit of this barium solution that's just stuck in the lumen, which is okay. Nice, thin, smooth stripe. Now this bolus here, if you were seeing it real time, would move this way, this way, this way, and bloop, finally fall into the stomach. And it would do that within seconds. Okay. If you take an X-ray afterwards, a lot of times you'll see this staining, if you will, where a little bit of barium is still hanging out in the esophagus, and you can see these linear areas of being striped, which is typical after the barium has moved through. Okay. But you shouldn't have big collections or dilated esophagus or pooling of the barium that just sits in the esophagus. Cats are a little bit different. Their esophagus, the cranial half has the normal like striping that dogs do, but if the residual barium in the esophagus and the caudal aspect takes on this herringbone appearance, and that's because if you remember from anatomy, the caudal 1/3 of a cat esophagus is made out of skeletal muscle. The rest of the esophagus, like the entire esophagus in a dog, is made out of smooth muscle. Okay. And so that skeletal muscle, where the barium is, residual barium is in that area, has a different pattern, kind of a herringbone or stripedy pattern, like this, as opposed to that longitudinal stripe up here. And that's just another cat thing. It also explains why cats, when they vomit, they can vomit 4 feet away from them across the room. Okay. Okay, megaesophagus, you'll learn about more when Dr. Warner talks about thoracic radiology with you. So we don't really need to spend any time on the causes of it at this point. This is a dog that has megaesophagus. There's his trachea. Here's a great big dilated esophagus right in here that you can see. It's huge and dilated, even it's way down here. So that's all esophagus. And normally you shouldn't even see the esophagus on X-rays. Okay. We don't need to worry about that. We don't need to worry about that. Cystograms and urethograms. Okay, cystograms is a study of the urinary bladder, and a urethrogram is a study of the urethra. Okay, typically the contrast that you would want to use for this is going to be one of those iodinated contrasts. Again, the way to remember this, barium contrast material is only ever used in the GI system. Okay, iodinated contrast material you can use depending on what you want to use it for. It can be injected IV or directly into the urinary bladder or the urethra, but you wouldn't want to use barium if you're going to put it into the bladder. Barium is only for GI studies. Okay, so we do these studies typically to diagnose a rupture of the urinary bladder or a tear in the urethra, or sometimes you'll use these to diagnose a urethral stricture or stones in the urethra. Okay. The only type that you're probably going to do is either a positive contrast cystogram or negative contrast. So positive contrast, typically you're going to inject iodinated contrast material via a catheter into the urinary bladder, and you fill the bladder up with contrast material and see if it leaks out of the bladder radiographically. Okay, easy enough. Negative contrast cystograms, you're going to now blow the bladder up with room air. And typically with these, you're looking for areas of bladder wall thickening, a mass lesion in the bladder, or a stone in the bladder. Okay, again, ultrasound has taken place of a lot of this. The key with cystograms is kind of like when we talked about an upper GI study. You have to give enough barium solution in the stomach to do a proper upper GI study. So you have to inject enough barium to distend the stomach. Well, the same can be said for urinary bladders. You have to give enough contrast material into the bladder to blow the bladder up and distend it. Okay, you can't have a Labrador that could have a huge bladder and you inject 2 cc's of contrast material into the bladder. Doesn't make sense and it doesn't work. So you have to make sure and give enough contrast material to distend the bladder. Okay, the pneumocolon study, again, we talked about that. You stick a catheter or tube, red rubber tube or whatever, into the dog's rectum, into the colon, and you blow the colon up with gas. With this particular one, again, I would not recommend using your mouth to blow into the tube. That can result in diarrhea in your mouth, and so I would probably refrain from that. But the best way is use a bunch of syringes and fill them up with gas, and you can inject those into the dog's rectum. Okay, again, there is no dose, and really you can't overdose them because if you fill up the colon with gas, the colon stretches out really big, and then it would just go into the small bowel anyway. So you want to give a bunch of gas into the colon and then immediately try to shoot your x-rays before the gas passes. Okay. Sometimes, and it's kind of a weird thing to say, but sometimes you kind of have to pinch their butt shut. Okay. So you might have to, physically hold their butt shut around the tube while you're shooting the x-ray so they don't leak all the gas out their butt. Okay. But a pneumocolon study is, again, very useful. And the biggest use of it is going to be to differentiate what is small bowel, what is colon in the abdomen. Okay. Another good general rule that I will tell you going forward is that if you see a foreign object in the cecum or a colon of a dog, leave it alone. Okay. You almost never, ever go to surgery and remove a foreign object from the colon. If it makes it into the colon, it will pass. Okay. Every now and then I've seen, and talking to the surgeons, they will have a foreign object that gets stuck in the colon. And what they do for that is if they go to surgery, they go to surgery and they milk it out of the colon through the rectum. They don't open the colon up. Okay. You open a colon up and that's going to be a disaster because you're unleashing all kinds of hell and bacteria into the peritoneal space. And so you never want to open up a colon. Here's a dog. This is a weird case. He had a colic intussusception. So we gave some gas into the colon, and you can see there's this large multilobular mass inside the colon, which was an intussusception. It's kind of a weird case. Okay, that's all I have to talk about special procedures. So the ones that you're going to use and probably need to know a little bit about is an upper GI study. I would know the dose for that because you're going to need to give enough barium. I would know that how to give it. You give it via stomach tube. You don't give it in dog food mixed and let the dog eat it. I would know a little bit about upper GI studies. I would know maybe a little bit about a cystogram, why you would do one like for ruptured bladder or looking for stones or stuff like that. But that's pretty much it as far as special procedures. Okay. And again, realize that ultrasound, which we're going to start next week, it takes the place of a lot of these. Okay, so that's it for today. Your job now is to take all this information and study for your test, which will be Friday morning at this same time. Is that cool? Okay, if you guys have any questions, please let me know. I'm here to try to answer them anyway.